You may wonder, what is concussion? Is it just if I just hit my head on the side of a wall, just tap it, is that concussion? Typically not. Concussion is a jolt and a hit to the brain severe enough to cause some of the symptoms. And the symptoms typically are due to there's a change in the metabolic reaction to the heat as well as chemical reaction. So those cause the symptoms of concussion, which could be you become nauseated, you start vomiting, headaches, and you start experiencing different cognitive function later on. So typically with concussion, 15% of the time, most of the time, it's resolved, recovered. You recover within, say, a few days, 10 days to a few weeks, a few months. You should recover and get back to your normal state. However, there is 15% of patients with concussion who do not recover, and they continue to experience cognitive issues, emotional issues, even after months, sometimes even after years. And it could be due to the concussion they sustained possibly many years ago. Some of the symptoms would be you forgetting information, you having trouble processing information, executive function could be affected, and it's really important to be evaluated by a neuropsychologist to determine, we know the cause of the concussion. Let's say if you hit your head, you're in a car accident, we know that, but it's more of what areas of your brain were affected by the hit to your head. So it's important to have that complete objective evaluation that neuropsychologists provide to determine which areas of the brain are impacted, which are not, and how is it the best way we can help with your recovery. If this is more psychological issues that's going on, that's making the concussion symptoms linger on longer than the normal recovery time, then our recommendation would be you should probably see a psychologist for psychotherapy. If it's a need for medication, they could see a psychiatrist for the medication. If it's need for improvement in certain skills, then we can also offer that in rehabilitation, helping your weaknesses, some of the deficits in your cognitive function, helping those, utilizing your strengths to help with the weaknesses. And there are other ways that there are exercises that can be done to improve your thinking skills after a concussion. So it's really important to, after you have a concussion, you have not recovered, after say the first few weeks, few months, even after 6 months if you haven't recovered, please give us a call and we'll be happy to see you, or you can see your neuropsychologist.